Hi, I'm Dr. Darrell Story. This video is an introduction to the basics of Parkinson's disease. Parkinson's disease is about 200 years old, or at least that's when it was first described by Dr. James Parkinson. Today, there's about 630,000 people in the United States with Parkinson's disease, and men are more commonly affected than women, about 1.5 times. What is Parkinson's disease? Well, it's based on 4 symptoms or observations that a person has. Number 1 is tremor. People with Parkinson's disease often have a tremor, and it may even be the main symptom or the only symptom. The tremor with Parkinson's disease is different from the more common type of tremor called essential tremor, because the Parkinson's disease tremor is present when the person is at rest and they're not moving their hands. Another feature of Parkinson's disease is stiffness. The muscle tone just becomes more rigid. A third symptom is slowness. People with Parkinson's disease are not able to make rapid movements of their arms or legs, and this leads to some of the manifestations that a person experiences in their everyday life. The fourth symptom of Parkinson's disease is instability and a tendency to fall. And this can obviously be one of the most troubling symptoms of Parkinson's disease because of the tendency for injuries. So when people come to me for an assessment for the possibility of having Parkinson's disease, I'll go through all of these symptoms and we'll see if the diagnosis fits. And I'll also think about some other causes of some of the symptoms, such as maybe a stroke or arthritis in the neck that might be causing gait problems because of compression of the spinal cord, or neuropathies that are very common and can cause problems with balance or coordination. We'll review all of these things and make sure that we're onto the right diagnosis. What causes Parkinson's disease? Parkinson's disease is a degenerative condition. And in the case of Parkinson's disease, the cells that are degenerating are inside the brainstem, and they're the cells that produce a brain chemical called dopamine. And when the brain is not receiving enough dopamine, it creates the symptoms that people have with Parkinson's disease. Once we've made a diagnosis of Parkinson's disease, the issue then is treatment. So there's no cure for Parkinson's disease. We have medications that improve the symptoms and are very good at alleviating the symptoms and the problems in a person who has Parkinson's disease. The first thing we'll talk about is whether you need to be treated. Some people have mild symptoms that don't really bother their everyday lives very much. And in that case, we can watch and wait and see how things go. But once symptoms have become more troublesome or impact the person's daily life, then we can think about introducing medication. And there's several. The most commonly used medication is called Sinemet. We still call it Sinemet, even though that's an old brand name that refers to the Latin for without emesis, sine emet. It's a medication that contains dopamine and another substance that blocks the capability of dopamine to cause nausea. Basically, the dopamine, by pill form, goes into the bloodstream and then goes up into the brain, and it enters the circuits inside the brain that are malfunctioning in a person with Parkinson's disease, and it alleviates the symptoms. There are several other classes of medications that we use for Parkinson's disease, and some other types of medications really may work better for the individual patient. It requires some discussion and some understanding of that person's situation, the nature of their symptoms, to really find the best approach. And there really are a lot of options. So Parkinson's disease is a very manageable condition, and it can be manageable and treatable for many, many years. It's a matter of having a good relationship with the doctor that's taking care of your condition, and being able to have a relationship with that doctor and to be able to have access to that doctor so that you can explain symptoms that you're having, whether it's from the disease or from side effects of medications. As the years go by, sometimes there are complications, and sometimes the medicines don't work as well as they did in the earlier years. And so this requires a lot of management of medications and modification of medication regimens. So if you have the symptoms of suspected Parkinson's disease, talk to your doctor or find a neurologist that can help you figure out whether that's the right diagnosis and get you to a good treatment plan.